tonight. Doctors calling on the Biden administration to declare an emergency in response to this alarming surge that we're seeing of children being hospitalized with RSV and the flu.
In a letter this week, the Children's Hospital Association and the American Academy of Pediatrics warned that, quote, unprecedented levels of both viruses are pushing some hospitals to the breaking point. This coming as both North and South Carolina continue to stay in the very high flu activity level, according to the CDC.
WCNC Charlotte's Carolyn Bruck takes a look at the strain this is putting on hospitals across the country.
Overwhelming right now in so many ways.
According to the CDC, infants 6 months and younger are getting hospitalized with RSV at 11 times the rate than before the pandemic.
The burden of infection in children is very high right now.
The agency also says flu hospitalizations are at a decade high, with children and the elderly most at risk. It's something doctors at Atrium Health say is happening here, too.
We're all seeing this year a very, very significant increase in cases of other respiratory viruses, specifically flu and RSV.
According to data from the Health and Human Services Department, as respiratory viruses surge, more than 3/4 of pediatric hospital beds are occupied across the U.S. So what would an emergency declaration do? It would provide hospitals with the flexibility needed to free up bed capacity and staffing to make sure children get the care they need. The CDC says RSV and the flu are surging in part because people have largely abandoned measures implemented during the pandemic. Doctors say if you or your child is high risk, consider pulling those masks back out.
You know, considering masking is certainly something that you can throw in to try to protect yourself against spread of respiratory viruses.
And with holidays on the horizon, parents are wondering what they should do.
If you're sick, please stay home and stay away from other people.
Doctors are reminding everyone that it also isn't too late to get vaccinated. Carolyn Bruck, WCNC Charlotte.